Hi. Are you someone that has limited family and not a lot of access to friends that can help out in a time of need? Are you someone that didn't set up a long term care policy and is working off of a limited budget every month? Are you someone on Medicare, regardless of an Advantage plan or a supplemental plan? If you meet one or all of these criteria, this video is for you. I'd like to tell you about a solution, a funding solution that we have found that you can affordably put into your portfolio to help you get the additional care that you might want. This is what's going to help keep you out of the rehab facility for a long time. This is what's going to help bring funding to the table to help with non medically based home health care. Most people are confused about Medicare, whether you have a Medicare supplement plan or an Advantage plan. Most people don't really understand the difference and the true benefits embedded in the plan. Most people have no idea how home health care is treated within these plans. And the saddest thing of all, 60% of Americans now are on Advantage plans. And I get it. They're affordable and they're great on a lot of levels. But the one thing that they've done is they've stripped out a lot of the home health care benefit of these plans. They're trying to control costs by grouping people together in facilities so one person can take care of many. We've all been to rehab centers and nursing homes. It's not the prettiest deal. It's not the funnest place to visit. So, if you want to create a funding source to either help you pay for some of these services or replenish the savings that you've worked hard to acquire, we should talk. It doesn't matter what your pre existing condition is, as long as you're at home and not in a skilled nursing facility or currently on home health care, you are eligible for the plan as long as you're under the age of 86. If you do have a pre-existing condition, that's okay. Just know that you're not going to be able to utilize the home health care benefit within this plan for 6 months pertaining to that pre-existing condition. If something else pops up, you can use the plan immediately. Otherwise, you have to wait 6 months. This is a huge funding opportunity. And here's something I think that's very interesting. Let's talk about the medical versus non-medical home health care situation. A lot of the Medicare plans will cover some home health care benefits pertaining to medically based home health care. So sending a wound care specialist, a physical therapist, a speech therapist, all these different therapists, they will likely cover some of that cost for you, which is great. The costs that they're not going to cover are the non-medical based home health care services. Changing of the bed, bathing, eating, cleaning the house, all the day in, day out things that people just need help with. Let's work together to create a funding mechanism for you to afford some of those services. When the wound care specialist comes over and treats you, Medicare will likely pay for that, hopefully. Reality is, we're going to submit a claim to this policy I'm referring to, and they're going to cut a check directly to you for $150 to $200 per visit. We're creating a funding pool now that you can utilize for non-medical home health care. I'd love to tell you more about the policy. It's real. Give us a call. My name is Mario Lizarraga. I'm with Maximize Asset Protection. We look forward to working with you.